Continuing the conversation about the benefits and support offered to veterans in Texas with Tom Palladino, Executive Director of the Texas Veterans Commission. Well, Tom, last time we talked about the range of benefits, but it isn't enough just to be, a state with great benefits. You actually have to have an agency that could administer, and that's TVC. Tell us about, the geography, the number of people, the size, the scope of your operation.
Sure. Thanks, Paul, for asking that question. So the Texas Veterans Commission, of course, is a state agency of veteran affairs. It's a commission because there are 5 commissioners appointed by the governor. They're part-time. They meet quarterly and set policy for the agency. And then I'm the executive director and I run the operations of the agency. We have 438 FTEs. They are spread in 85 cities across the state. And, we have it's very geographically dispersed. To all the programs that I mentioned previously, that we have to ensure that there are services across the state, because Texas is so big, because not all veterans and their families want to be served remotely. They want to be served in person. So you need to be in those communities. Additionally, we have over 200 county veteran service officers that we train and accredit with the VA, and we work very closely with. So we're closely out there. We also have another state agency called the Veteran Land Board, which manages the cemeteries and manages the veteran homes, the veteran cemeteries, veteran homes, and also have land loans, and we work very closely with them. So how are we organized? We broke the departments, and we broke the agency into divisions, and then it broke those divisions into departments, so kind of like the military. And then we have an operational division, we have a resource management division, and so they then in turn have broken their departments down into like districts, and it's broken all over the state. And so the claims advisors and the healthcare advocates, they're embedded in VA facilities. I mentioned that earlier. It's very important. It's no cost. We worked MOUs with the VA, with VBA, VHA. Not every state has done this to this extent. We're not only in the regional offices, but we're in all the healthcare offices, and we're also on the military installations. And in some locations, we're located on county. So we save the state money because we don't pay rent, but we also help those organizations because we're right there side by side, with those organizations helping veterans. And we have a really good relationship with all of those county, federal, and state organizations. Our employment representatives are in board. We have 28 workforce boards, and they're all in board American Job Centers. And of course, they are embedded in with them, working side by side. So we're broken out there. We have quarterly meetings. We present information to our commissioners, who then make policy. We also work with the legislature, the governor's office, lieutenant governor's office. The legislature session meets every other year for budgeting and bills, but we're in very good constant contact with all the legislators, as well as our U.S. congressmen and women as well. And we work as a resource for both of them. The governors, both Governor Perry and Governor Abbott, as I've been here since 2010. I retired from the Army in 2009, and I started this job in 2010. And I've been here a little while. So we have great support from both governors and lieutenant governors. And they actually, provided emergency funding to start pilot programs. Our healthcare program was a pilot program. We had claims strike force teams that were embedded in the VA regional offices at Houston and Waco. And that was a governor's initiative initially. And then we got, we actually put it in our budget. And they were initially there to bring down the backlog, which they did, and now they're working, difficult cases within VBA. Partnerships are extremely important with us because we could not do the job we do without our partnerships. Number one partnership is the county veteran service officers. So we do train and accredit them with the VA, but they are their own center of the center point for veteran services in their county. But we work very closely with them on any type of veteran service. They're our partners. And then our other state agencies. We have a Texas Coordinating Council for Veteran Services. This is state mandated. I chair it. It's 22 state agencies. We come together. We meet quarterly. We do a report every 2 years to the legislature, the governor, lieutenant governor, which tells the state of veterans for Texas. So basically, it's what is the needs of the veterans and their families? What are the services to meet those needs? And what's the gap? And we bring in nonprofits, we bring in local government, we bring in other state agencies, we bring in veteran service organizations. And everybody contributes to that report. And that report actually then is the foundation for some legislation when it comes into future legislative sessions to do. But there's a lot of state agencies that have services out there for veterans, and we want to make sure we advertise that and we refer veterans back and forth between our agencies. So that's extremely, extremely important. We do have a number of websites and, of course, the Veterans Network as well.
So I'd imagine, given your tenure, Tom, and the scope of what you do, that when someone becomes a new, head of the Department of Veteran Services in a different state, they reach out and ask for some advice to you about how to run the organization, things to think about. What kind of things do you point out to them?
So we have an organization called the National Association of State Directors of Veteran Affairs. Okay, it's NASDVA. And it is an association of all the state directors of veteran affairs. We meet twice a year. In February, we meet in DC every year. And we have a very close relationship with the U.S. Department of Veteran Affairs. And one of the things that we do is that we share best practices with all the other states. So when you're a new director of veteran affairs, you really don't, have a playbook. So you walk into this job and you're like, what do we do and how do we do it? And every state does a little bit different. So what we do is we make sure that we make those new directors of veteran affairs in their state knowledgeable about what all the other states do, but they have to focus in on what they do. So if they do disability claims or if they do education, right, or depending on what they're doing, they have a grant program or they support veteran treatment courts or they run the veteran homes or they run the veteran cemeteries, then we will link them up with other states that do that and do it well so that they can tell them, like, here are some best practices of how to ensure that you provide the best services to your veterans in your state, because they just don't know. All they know is when they get hired for the job, they talk to their own staff, right? And so what they really need is they get a perspective from other states about how they do their business. And so it really helps them do a better job in their state. So it's a great organization to learn on best practices.
Now, final thought here. You were just indicating you've been the executive director for, I guess, 13 years, if I did the math right. I guess something you're like most proud of during when you think about your tenure?
Well, I would say that the most proud is our hardworking staff. All of our employees, whether their titles are, counselors or advisors or representatives, they of all the thousands, the hundreds of thousands of veterans and their families that they have helped. I mean, really, that's our job. Our job is to advocate for and provide superior service to our veterans, family survivors to improve their quality of life. And they have done that. I mean, so if we go back and we look at the hundreds of thousands of veterans that we've helped, it's quite amazing. So I'm really proud of the people in our organization that have done this job. They serve their country proudly because we have 85% veterans, or their family members of veterans, or they support veterans, and they then continue to serve veterans, and they want to do that. So the morale is very high to do this job, and we try to support our employees as best we can in order to do this job. And I think that that's a very fulfilling. So that's the most fulfilling thing about this job is how we make a difference. We make an impact on a veteran's life in their family's life.
Well, that's great. Thank you, Tom. Thank you very much.
Thank you, Paul. I'm glad to be here.